All right, so it looks like we're starting. Assalamu alaikum, everyone. My name is Asad. I will be part of your co-host as Dr. Asad explains what's going on with the entire COVID-19 slash coronavirus crisis here. He is a doctor. He's an anesthesiologist with the Henry Mayo Coalition of Hospitals in Santa Clarita. So he is definitely from the medical field. He definitely knows, he's a firsthand observer of what's going on. So please, definitely, if you have any questions, hopefully he will be able to answer a lot of the questions. There are some questions. If you guys do have any questions, please hold them on until the end of the presentation, or you can use the chat feature that's in Zoom to voice whatever questions you have. And without further ado, Dr. Asad, if you could take over from here, and please, good luck.
Assalamu alaikum. I would like to discuss about the present situation of the coronavirus, COVID-19 pandemic, and what is our responsibility as a community member. Before I go to the discussion, I would like to say a few words regarding the background, why I feel like that at this moment I have to discuss this. As you all know that we are in COVID-19 pandemic. It is affecting the whole world, and to fight against this pandemic infection, most of the world is observing physical distancing, and some part of the world is under complete lockdown. And from our experience last almost 4 months, it looks like that physical distancing is working. And as part of the epicenter of the COVID-19 pandemic, at this moment, United States also observing physical distancing almost more than a month. And as I said before, that it looks like that it is working, but unfortunately, White House wanted to loosen it and reopen the market, but the doctors, scientists, especially, the Dr. Anthony Fauci, and I myself think that this is not the right time to loosen it or to reopen the market. So people are confused now what to do. I'll show you this slide. You can see that a gentleman is holding a placard. It says that it's difficult to close business for 3 to 4 weeks, but it's more difficult to close a casket of a loved one for entire life. This actually represents what situation we are in right now. Now we have to decide whether we would like to close our business or we'd like to close the cascade of our loved one for entire life. I know all of you know that it is difficult to close the business because of the negative impact of the negative economic impact, but it is more harder when we lose our loved one. So we have to decide. I'll try to discuss the facts and figures on that present situation so that we can have an informed decision what to do from now onward. Before I start to discuss regarding that, I would like to pray for all the souls that perished in such a short period of time due to COVID-19 pandemic. My deepest condolences goes out to each and every one who is grieving the loss of their loved ones. I would like to take the opportunity to thank and show my utmost respect to all frontline workers, doctors, nurses, and other healthcare providers for their dedication and sacrifices at this unprecedented crisis for the survival of the mankind. My respect also goes to all essential workers like grocery store workers, postal workers, bank workers, and other workers who are working relentlessly behind the scene to win this fight against the threat of the humanity we are facing right now. I would like to take this opportunity to thank you, the community member, who are following the advices of the authorities, maintaining physical distances, protecting themselves, and protecting others. So fighting is going on in 3 fronts. Government, World Health Organization, and other local authorities is doing their part. Healthcare providers in frontline doing their part. And as a community member, we have our part to do and win this war against this coronavirus. I'll try to focus on what is our responsibility as a community member at this unprecedented situation. Before going to discuss our responsibility in detail, I would like to discuss a little bit about what we are really facing. Unfortunately, the answer is we don't know. We have very limited knowledge and experience about the nature of this viral infection, and that makes it very difficult to deal with this challenge. Whatever knowledge and recommendation we have as of now is anecdotal. There is no clinical study to substantiate that, as it takes time to have clinical controlled study and come to a conclusion. For the simplicity of understanding, I'll try to compare the flu virus with the coronavirus. We know the nature, excuse me, we know the nature of the coronavirus, how it transmits, its pathophysiology, and how we can prevent it. And we have treatment for flu virus. On the other hand, we are still blind and struggling to get all those scientific facts regarding the coronavirus. We are racing to invent a vaccine against it. Now, I'll put together all the informations we have at this moment regarding coronavirus. But remember, all these informations are based on random personal experiences of the clinicians and scientists all over the world. And the important thing is it is changing every day. Like flu virus, coronavirus is contagious and it causes respiratory illness. Now the next is transmission. This is very important, how it's transmitted from infected person to healthy person. As of now, we know that it transmits through droplets. When an infected person is coughing, sneezing, or even talking. And next important way to transmit this coronavirus is airborne route. The tiny virus coming out from an infected person, when that person breathes out, it floats in the air almost half an hour, even when that infected person is not there. The tiny virus, and healthy person can inhale easily, and that makes this coronavirus is very easily transmissible than flu virus. When an infected person sneeze out or cough out this virus through droplets, it settles on the object, and it can be alive there for hours to days. And when any infected person touches that object and in turn touches his face, nose, or eyes, that person can get infected. And we know that it is transmitted, or it enters into the body not only through the nose and mouth, it can enter into the body through eyes too. And there is some anecdotal evidence that the coronavirus, unlike flu virus, can transmit through fecal-oral route. That means when any infected person defecate, not washing his hand, and touches any food, and any person take that food or eat that food, can get that infection. And an asymptomatic patient can also transmit this virus before symptoms appears and few days after symptoms subsided or disappears. In this coronavirus, the symptoms can appear, it can take 1 to 14 days to have these symptoms. Now, what are the symptoms? It's like flu. There may be cough, fever, sore throat, body ache, fatigue, and there can be chest pain, shortness of breathing. And sometimes there can be diarrhea and vomiting. And since it is a new virus, unlike flu virus, people do not have any specific immunity against this virus. People at any age can get infection, but those who are more than 60 with hypertension, diabetes, chronic respiratory illness like asthma, COPD are more susceptible. People of any age who are immunocompromised, they're more susceptible to have this infection. Now I would, excuse me, I would like to give some statistics regarding the flu to have an idea what is the impact of flu every year that we are facing. Estimated 9.3 to 45 million case of flu we have every year in United States. Out of that, 12,000 to 61,000 people die every year in United States. And the death rate from flu is only 0.1%. But death rate is much higher in COVID-19. We do not have any number yet, but it appears to be more than 5%. Another very important contrast with flu, that death rate in COVID-19 below the age of 60 is much higher. Most of the death in flu is usually above 60 with all those comorbid conditions, as I mentioned before, like hypertension, diabetes, chronic respiratory illness. But death in COVID-19 below the age of 60 is very higher in comparison to the flu. That says that coronavirus is more lethal than flu virus. Now, what makes this COVID-19 is so unique, and why we all are so afraid, and we call it unprecedented crisis of the mankind. The flu virus is very unique because we have very limited knowledge about it. There is no specific immunity in the population. There is no vaccine. We do not have adequate testing to detect new infection. There is there is very inadequate testing to determine the herd community, or what is the herd immunity, or what are the status of the immunity in the community. Only so far I know that there are 2 places where they started to test the immunity, specific immunity against this coronavirus in the community, one in the USC and the Stanford University. And there is no specific treatment for it. Whatever treatment we give is just symptomatic and compassionate care. Because of all these factors, there's very rapid spread of this coronavirus, and that can cause a huge load of patients in a very short period of time for a hospital or for a country, and that can result shortage of healthcare providers, equipments, medicines, and other logistics at a point that doctor has to decide who gets the treatment and who does not. That's a very critical, inhuman situation. Unfortunately, Italy has to face their situation, and that's very unfortunate. Now I'll talk about what is our responsibility, depending on all the facts and figures that I have discussed so far. First of all, we should take it very serious, but we should not be panic. And in general, we have to follow the advice from World Health Organization, CDC, and healthcare providers and other government authority. First of all, maintain physical distance, but maintain strong social bonding. Stay home, stay safe. As I said, that you have to maintain strong social bonding, and that is very important. We have to stay connected with our family and friends through social media and other technology. Only we go out when it is absolutely necessary, but before we go out, we have to put mask on. But one thing you have to remember, that, as I mentioned, that it may transmit through airborne route. So that tiny virus can enter into your mouth or nose, even through the mask, and also through the space between the mask and your face. And as you know, that it can enter into your body through eyes, and we are not covering our eyes. So when you go out, even if you put a mask, it can enter into your body through your eyes. So when you're putting a mask, you are not protecting yourself, you are protecting others. So if you are protecting others from the droplets coming out from your mouth when you are sneezing, coughing, or even talking. So if all of us put masks, then I protect you, you protect me. That's why it is mandatory, especially in California, to put mask when you are going out. Though we cannot protect 100% ourselves, but still it helps to spread in virus from one person to the other person. Then putting a gloves. You put a gloves and you go to the store, maybe grocery store, you are touching all the commonly touched objects. Probably some infected person also touched that objects. There may be virus there. So your gloves may be contaminated. Make sure that you don't touch your face with that contaminated gloves or any part of your body. Maintain physical distance, 6 feet, or if possible, more than that. And if you happen to be that you do not have mask, then cover your cough or sneeze with your elbow. And when you are paying, try to pay in a counter without any clerk. Try not to use your credit card. Pay with Apple Pay or Google Pay. And when you are coming to the car, take your gloves off before you enter to your car, and don't touch the outer surface of the gloves because it is contaminated. And also when you are removing your mask, don't touch the outer surface of the mask. When you come home, change your clothes if possible in the garage, and wash your hands with warm soap water or any other detergent at least for 20 seconds. And you can take shower too. Next, don't visit any infected or suspected COVID-19 patient. If by any chance you have to visit, immediately isolate yourself at home and go for self-quarantine for 14 days. Take plenty of vitamin C that will boost up your immunity. Keep praying, have faith on Allah, and that also increase your immunity. Always be positive. If by any chance you have symptoms, don't get panic. Isolate yourself. Don't visit any healthcare facility. Call your healthcare provider and follow their advice. It is also our responsibility as a community member not to get infected. Flatten the curve so that we can avoid overloading the hospital, and so that the hospital do not get exhausted with all the resources, and doctors don't have to face a situation where they have to decide who gets treatment, who does not get the treatment. Help community members who are in financial hardship due to this COVID-19 pandemic. Don't share any info on COVID-19 when you are not sure about the authenticity of the sources. There's a lot of info about COVID-19 out there in social media, which is not fact-based or unscientific. So what is the message we have after all those discussions? Since we have very inadequate knowledge about this virus, we do not have any way to protect ourselves. We do not have any vaccine. We do not have any immunity. There is no effective way that we can prevent that transmission, especially if we go out and if we come close to any infected person, as I mentioned above, that even after putting the gloves and mask, it is very hard to prevent getting infection. So why go out and take that chance? Only way we can prevent to get this infection is to stay home and stay safe. So that's all for today. Thank you for listening, and thanks for your time.
All right, I would again like to thank Dr. Asad to have come out and helped us with it. Dr. Asad, if you wouldn't mind, I just wanted to bring some questions to light, if hopefully to see how things are going, if you're okay with that.
Yeah, definitely. I'll try if I can.
Of course. Okay. So one of the very first things is I wanted to ask for what are some of the basics of the COVID-19 slash coronavirus crisis. I know you already went over all of them, so I'll kind of skip on to the next one. What I wanted to bring on the second question into light was going to be the stay-at-home orders, right? California went into lockdown slash stay at home for about almost a little over a month now, and we've seen the infection rate projections go down, like flattening the curve and all. We've already heard all of that. Now, it definitely has happened, right? We not as many people as we thought would get infected has gotten infected in terms of projections. So, but now that it's gone down, what does that mean for a general public? Should we still be as vigilant as we have been, or can we relax a bit overall, with the stay-at-home orders?
My answer is yes. Though it's going down, but I can give you my first-hand experience, especially if I talk about the Henry Mayo. At present, we have 35 patients in hospital, and so far 3 patients has died. And the number of the patient hospitalized, it was going up. It was like 5 to 10 for last 3-4 years, last 3-4 weeks. In last week, it increases very sharply, very high. Today it is 35 now. So this is just giving an example of Henry Mayo. In my opinion, I think we are at the peak level right now, not increasing as fast as it used to be. It's declining a little bit now, but we have to have that consistent low number of new cases, at least for a few weeks before we loosen this restriction of going out, number one. Number two is that since we do not have any means to protect us, what are those means? Is number one, vaccine. We do not have any vaccine yet. And to have a vaccine, it may take at least 12 months to 18 months. But now the question may come, we have to wait that 18 months to go out? Answer is no. I'll tell you why no. And second thing is that we need to make sure that we have that herd immunity, or the immunity of the community or the people in the community. That immunity can develop by getting infection and also having vaccine against it. So there are a lot of people in the community, they have that infection that we don't know, or they themselves do not know it, because they may be asymptomatic. They may have infection, but may not have any sign symptoms. And they can develop immunity, they can produce antibody. And as I mentioned before, that USC conducted a study to find out that herd immunity, or that immunity at the community level. And they found that 5% of the people in LA County is seropositive. That means they have antibody in their blood. So somehow, sometime, last 3-4 months, they had that infection, and they developed that immunity. So only 5% of the people. So until and unless we have vaccine to prevent that new cases, or there is enough herd immunity, or enough people in the community has that immunity through that infection, subclinical asymptomatic infection, or getting an infection, it will not be wise to let it go and open it up completely, and that the consequences will be that there will be more infection, a big surge of infection, And eventually we may have to go back to that stay home or that restriction to go out. And at the same time, we'll have the huge load of the patients, and there will be more death. So at this moment, since we do not have any vaccine, we do not have enough way to protect ourselves uh, by providing the mask and also by uh, testing that whether we have enough herd immunity or immunity among the people in the community, uh, it will not be wise to open it up, but it will be time. It will take a lot of time to get that vaccine and also to test the immunity in the community. So we can depend on one thing to see whether there is declining new infection consistently for a few weeks, maybe 3 to 4 weeks or 6 weeks, then probably we can loosen it up, we can open the market.
Yeah, so not anytime soon is what we should take from here. Is we shouldn't be relaxing as much as we are right now, considering that.
No, we should not, at least, especially it depends on the places or the country or the county we are talking about. Especially for LA County or California, I think we probably the peak level is already there and we are declining, but we need to have this declining status at least for another 4 to 6 weeks. This is in my opinion.
Okay. Well, thank you so much for answering that. I'm going to continue on with some more of the questions. Another question that actually, this is something one of my friends brought up earlier today in one of my we were talking about this. So I guess better ask a doctor. I understand this isn't your specialty, but I'm sure, since you're at the hospital, I'm sure you've heard someone talk about it, or even you've talked about this yourself. Like Harvard came out with a very rough, very quick study saying this a lockdown might go on until 2021, even 2022 bleeds into it. But that is if we continue going out like we are now. Do you think LA or even like our community in Santa Clarita in general, do you think we are prepared for this lockdown or stay-at-home order to last as long as 2021? That is, still like 8 months away, 7 months away. Do you think we're prepared to stay home that long?
Definitely we are not prepared, and you have to have a check and balance. I mean, I know that if we maintain that lockdown, definitely we can decrease the new cases, and as such, we can decrease the number of deaths. And at the same time, the downside of having this lockdown is the economic impact. And there's a huge economic impact we all can see and can feel. So ideally, it will be wise, as I mentioned earlier, that if we can, without any negative impact, if we can maintain this lockdown another 12 months to 18 months, as Herbert that mentioned, that will be the ideal situation. When we will have vaccine, we can vaccinate that people. We have enough testing kit to test how many people are having infection. And also we have all the testing facilities or means to find out the herd immunity in the community. And if we see that, yes, we have enough herd immunity, we can have the vaccine, then we can open it up. That is the ideal situation. But down the road, if we see that in 4 to 6 weeks, the infection rate is going down, as you can see in China now, then probably we can open it up. But we have to be very vigilant, and we have to, especially community member and the authority, very vigilant and try to find out the vaccine and the other testing means so that we can test. And then when all those the vaccines are out there and we can vaccinate the people, at that time we can say that, yes, we can open it up. But considering the negative impact, especially on the economy, probably we have to balance it, whether how much risk we are taking to open it up. Probably after 4 to 6 months, the risk will be much less than that we have right now, because the infection rate will be less. This is the nature of any pandemic, and we can see that, especially for this coronavirus also, the other countries like Italy, Spain, China, so far I know that they have only 8 to 10 new cases in last 24 hours and no death. And Italy is also planning to open it up. So when the infection rate clinically, we can see, number-wise, you can see that it is consistently going down. Probably open it up. If we don't have to keep that lockdown state for another, like till 2021, that will be an ideal situation. But because of the negative impact on the economy, probably it is not feasible, and I think it is, we should not do it. But if down the road there's always a chance that it can come back again, then probably you have to go back to that lockdown state again, until and unless we have the vaccine against it and we can vaccinate the whole population.
Okay, yeah, thank you so much again. So the next question is kind of, roped into what you were just saying, the like a few weeks from now, 4 to 6 weeks now, if you see it going down, we can start opening up the economy again in general. Something that like the same study, they did say this was a very rough study, and it is very concrete. It was, very quick with the very limited information that we have as humanity has now. But they mentioned something that could also end up happening is what you mentioned towards the end, is something called like a intermittent lockdown, right? So maybe basically we would go out for a few weeks, but then every month or so, every 2 months or so, you'd have to come back into lockdown. And that way we would be able to build the herd immunity, as you said, just because more people will, even though we are going outside, we're still going to be in lockdown shortly after. And hopefully that will help isolate cases of the infection as much as we can. Do you think that is a plausible, do you think that that's a possible thing where, we go out, normal, we go back to normal, let's say, quote unquote normal, but then, after a few weeks or after a month or so of being outside, we go back into lockdown. Do you think that is that's a feasible option that we can explore now? Do you think that's possible?
I think down the road that we have to do and we'll be doing, but make sure that we are not opening up prematurely. That is the point here right now, that yes, at some point we'll open it up and we'll go out, but we should not do it prematurely. And according to all the scientists, doctors, those who are in the field, they're thinking that right at this moment, it will be premature decision to open it up. And probably depending on the state we are talking about, and especially for California, especially for LA County, in my opinion, and the other doctors or scientists, their opinion is to wait at least for another 4 to 6 weeks, and then probably try to loosen it up. I can tell you about our hospital. We have discussion every day, and every day task force, they sit together, they discuss, and the decision is every day changing. So we thought that we'll open it, the hospital will open it up by the first week of May. But now, considering all the facts, they're thinking that that will be premature decision. So we are now thinking probably it will be after 15th of the May. So almost another 4 weeks that will be in a strict restriction. Hospital is not the lockdown, but not doing regular admission or doing the regular surgical cases. So limited services, only service for the COVID-19 patient and the emergent patient. So probably we have to take that route. Yes, as I said before, that we have to balance between the positive effect of the lockdown and the negative consequences, like the economic impact of the lockdown. So whichever is, we see the better, then we'll go from there. And again, coming to your question, yes, that intermittent lockdown, probably we have to do it, but we have to make sure that we are not doing it prematurely.
Okay, thank you so much. The next one is kind of like a general virology question, but again, I'm hoping you've heard something in your meetings, maybe during your meetings at Hrimeo, is a lot of these large scale pandemics, they happen in waves, right? They'll come, they'll go away for a few months and they'll come back again.
Come back
That's
again.
been yes. So that's been a trend with the example that I'm looking at is the Spanish flu, but it was the same thing. For the last 100, 200 years or so, most pandemics have had the same pattern, where they come, they kill a lot of people. Unfortunately, they go through the population, it goes down, and then it comes back again, and it usually it lasts a good couple of years. So do you think in the long term, is that how COVID will be? Maybe like now, now that we're in lockdown, it goes away for a while, but then come next year again, it might come back up. Do you think that's a possibility going forward? Is something you've heard like that yet?
I'm not a virologist, but I try to give you an answer to the question. But
yeah,
so far I know, and so far my knowledge is most likely this coronavirus will be like that of the flu virus, and most likely like that of the flu. Every year we have to take vaccine against this coronavirus too. And the problem at this point is we do not have any vaccine, and we do not know the nature of this infection, and we do not know any way to prevent this transmission. So that's why, as I said before, the unique condition about this coronavirus is that the spread was very fast, and all on a sudden there was a huge load of this patient in a hospital, and the hospital is in short of healthcare providers, medicines, and other equipments, and that causes this panic or the concern about this coronavirus. So when we will have the vaccines, and we'll have the treatment, we know how to prevent this infection, probably the impact of the coronavirus will not be as high as we have right now. But like flu virus, I think the coronavirus will have the same nature. It will come and goes, and we'll have the immunity, we'll have the treatment, we'll have the vaccines. So impact will not be as high as we have right now. It will be like that same like that of the flu virus.
So it'll come and go, but this is going to be our peak.
It is
depending on
state to state. This critical stage will be over probably in few weeks or maybe a couple of months, but still, until and unless we have the vaccine and we get that vaccine, I think everybody need to be very careful. Even if we go, say for example, 4 months, 6 months from now, if we go out, still we have to be very vigilant, and if possible, put a mask on, or try to make the physical distance, maybe 6 feet or more than 6 feet, and try to be very vigilant to see whether any people is coughing or any kind of signs, symptoms of flu. And we have to be very vigilant, though this acute crisis will be over probably in a few weeks or maybe a couple of months. We have to be very vigilant and careful until and unless we have the vaccine, and that may take probably 12 to 18 months.
So it's quite a while.
Yeah,
You're looking at
it's gonna change the way we live. It's gonna change at least for a few months to 12 months to 18 months before we get the vaccine.
Yeah. And that was actually going to be my next and my very last question is, it's kind of like what you kind of said, like what is going to be like our new normal, right? Because
Yeah,
we cannot go back to how things were before. And there obviously, now I'm talking about, the immediate future, right? Next 1 year, next 2 years, 3 years.
Probably, after we get that vaccine and everybody's vaccinated, like flu that we are doing right now, and from now, probably 1 year from now, the people will have immunity, and maybe I will have the immunity, even I don't know that I was infected by this virus. So there will be a substantial amount of herd immunity in the community, and we'll have vaccines. Then probably we may go back to a normal life. But until up to that point, probably we have to keep on doing whatever we are doing, not in that very strict sense, but whatever possible, we have to do it.
All right, so thank you so much. At this point, we still do have a few more minutes, and I know we do have a few people in our participants list. So I would like to open up the floor, if you're okay with that, Dr. Asad, open up the floor to see if other people had any questions, and they're very welcome to ask, join in, and they can unmute themselves and talk to you if you're okay with that. Okay, so yeah, just the overall takeaway from this, and thank you again for the presentation again. But I think the overall takeaway from this presentation is stay home, be safe, and there's still information coming out, right? We always have to keep an eye out, be vigilant, and then at least for the next 12 to 18 months, like you said, we should be extremely vigilant, at least, going forward. And then hopefully soon we can go back to a normal life. But with that, it does conclude our presentation, Dr. Asad's presentation and our hosting of this. If anyone has any questions, please, you can unmute yourselves, and the floor is yours.
So before ending, I just wanted to stress again that this is a very unknown virus. We have very limited knowledge. We don't have any vaccine. We don't have any treatment. Only way is not to get that infection is to stay home and stay safe at this moment. There is no other way. So as long as your healthcare providers, your local authorities, and your all the scientists and doctors ask you to stay home and stay safe, please do so. So we are done now.
Yeah, looks like everyone's leaving. So
Okay.
yeah, looks like it works. And thank you so much again, Asad Uncle, for coming up.
Thank you. Thank you for giving me this opportunity. I hope that it will help a little bit to our community.
Diego, of course. Thank you so much, Uncle, again. And stay safe as well. I know you're a doctor, you're on the front line. So especially thank you for being there. And it's a lot, right? So hopefully you guys are safe. And let's pray for the best going forward.
Thank you again.
Assalamu alaikum.
Assalamu alaikum.